Okay, so patient is Carla. She is coming in for tight upper hamstring pain, sitting and worse with sitting and walking, especially uphill. It's been going on for 3 months, so that makes me feel like it's chronic at this point. Let's see, she put probably from tight back. So I know that she's been seen here before for her back, so we'll look into that. She says she's taking care of it by stretching and walking, worse in the morning. She feels it most of the time. She says yes to numbness, tingling, so that makes me want to rule out neurological in the beginning, and that it's intermittent, so it's not constant. That's good. The numbness, tingling is intermittent. But with previous back injury, and then I saw that she was like previously treated for lower extremity pain with it, my first thought is it's probably coming from her back. Pain with sitting and walking, so that's kind of contraindicated to me, but we'll just see like more of a description when we talk to her.
Yeah, and knowing the previous history that we've seen her for was known stenosis too. So asking specific questions, or taking care of it with walking. We know that stenosis doesn't typically do well with walking, so maybe just pick at her brain a little more about what is the walking activities, what stretching specifically is she doing, and then the nerve pain too. She's on the gabapentin, so ask her about that a little more too as well. Okay. And then as far as like my diagnosis list, or as I go through her eval once taking her history, right now I'm thinking clear, neurological, clear her lumbar spine. I'm looking to reproduce. She did say tight upper hamstring, and especially uphill makes me think like rule out hamstring strain. Yeah.
But my first thought is it's most likely coming from her back, especially with, she said, numbness and tingling, and then, worse with sitting and walking. So my first thought, so rule out, so myotomes, dermatomes, lumbar active range of motion, and then kind of go from there. If I can reproduce it, go more into her low back, and then if I can't, find other ways that I think it could be coming from based on her history.
Yeah.
Okay. As far as red flags, she really doesn't have any besides the numbness, tingling. Oh, never mind, I lied, because it says she has had cancer, so that would be a red flag. So just checking in that she's following up with that. It says malignant melanoma on her thigh, so just making sure. But other than that, she didn't mark night pain. She's not having any other. The only other thing marked is difficulty walking. It says some.
Yeah.
So.
And she doesn't put down bowel or bladder issues, but some people don't put that down because they don't know the correlation of bowel and bladder issues. So just like specifically, make sure you ask her about that too.
Okay. Alrighty.